As we look forward to ACC 2025, let's have a look at what's on the agenda for this exciting event. Complete revascularization in the MVD-REV trial reduced MACE and cardiovascular mortality compared to culprit-only PCI. New DAPT data confirms stroke prevention benefits but indicates a higher bleeding risk. Beta blockers in MI patients with preserved EF appear to offer minimal advantages. In the THROMPE study, mechanical thrombectomy outperformed thrombolysis in pulmonary embolism, while the TRIO program found that treprostinil significantly improved exercise capacity in PAH. Global inequities in access to pulmonary vascular treatments remain a key concern. Aortic stenosis progressed more rapidly in TTRCA patients, according to the PROGRESS-AS registry. Direct oral anticoagulants showed superiority over warfarin for rheumatic mitral valve disease plus AF, and THROMPE standardization reduced one-year mortality rates across multiple centers. Despite modern therapies, only about 1 in 5 patients achieve adequate blood pressure control. The MANP initiative demonstrated robust blood pressure reductions in resistant hypertension, especially among African American populations. Pollution-induced telomere shortening also emerged as a risk factor for accelerated atherosclerosis. Significant racial disparities were reported in atrial flutter ablation outcomes. Class IC agents outperformed Class III therapies in patients with non-ischemic cardiomyopathy. Meanwhile, 4.2% of young female athletes had abnormal ECG results, prompting calls for clearer screening guidelines. Emerging therapies for transthyretin amyloid cardiomyopathy, including vutrisiran, RNAi-based treatments, and SGLT2 inhibitors, reduced mortality and improved quality of life in the HF-ATTR trial. SGLT2 inhibitors combined with colchicine cut MACE, while tirzepatide and nebivolol and valsartan synergy offered strong cardiometabolic benefits. In the HCM Power study, myosin inhibitors showed promise for hypertrophic cardiomyopathy, and new data revealed that individuals with Down syndrome have comparable long-term survival rates. Atrial septal defect closure consistently demonstrated favorable cardiac remodeling outcomes. Let's now switch gears and see how AI-driven risk stratification models, workflow optimization tools, and targeted screening programs promise to reshape cardiology practice. Machine learning algorithms like XGBoost and LGBM predicted mortality in post-PCI and AMICS with areas under the curve up to 0.955. Synopsys AI identified 29 ATTR-CM cases in just 1 week with 96% specificity, while DNN-based methods refined THROMPE sizing and rheumatic mitral valve detection. Wearables are transforming preventive care. Smartwatch-based AF detection correlated with a 1.6-fold higher MACE risk. AI-powered coronary calcium scoring uncovered previously unrecognized high-risk patients, and advanced imaging AI improved arrhythmia mapping. Yet 64 to 75% of clinicians reported limited machine learning knowledge, highlighting a pressing need for further education. Stay ahead in cardiovascular research and medicine. Like, share, and subscribe for conference updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.